Dr. Sreenivasa, CCM member, Dr. Bunny Gold, senior physicians, Dr. Nambudri, Dr. L. Mahadevan, and fellow physicians. Next, next. Until now, you are hearing about the diseases from the chapter number 1 to the chapter number 30 from Charaka Samhita, and it was based on the Guna Siddhanta. I can also speak about any particular chapter, but there are diseases that is beyond one chapter. You call it as Nidhanarthakara Roga, or you may even call it as the Vyadhi Sankara, where the diseases are related to the multiple chapters, and one such particular topic is the Marga Varna that's likely to extend for more than one chapter. If you scan the whole of the literature, and if you see the lifestyle that are being elaborated in the literature, particularly in relation to the causation of the illness, you have one, it is referred as a Gramya Achara, the second one, it is referred as Apatarpana Achara, or it may be the Santarpana Achara, and the fourth one is the Sadatura Achara. These are the major categories that are related to the lifestyle. The person who is living in the rural area, probably the facilities are not available for the promotion of the health. It may be in relation to the facilities that are available for the cooking of the food, and it may be the facilities that are related to that of the hygiene aspects, or it may be related to the protection from the wild animals. In these different aspects, probably the protection of the health may not be possible in the rural area, and therefore it is considered as a Gramya Dharma. And the second major issue is related to the apatarpana, that means the person who is taking less and doing excessive physical activities. And there is an imbalance in consumption and the utilization, and the result is illness, and that particular illness is referred as apatarpanauta vikara, and that's the lifestyle. The more important one, and that is considered to be the santarpanotta vikara. Again, there is an imbalance between the consumption and the utilization. And there is imbalance in the sense the consumption is more and the utilization is less, and that is referred as santarpana, and that particular lifestyle can precipitate an illness, and that particular illness is considered as a santarpanotta vikara, and the marga varna is considered to be an illness related to that. Yes, next slide. And how about that particular, the excessive physical activities that is precipitating an illness? Where he says that the combination of two, one is santarpayati yasnigdaihi, that is excessive consumption of greasy foods and the sweets. And that too, that is in combination with chestas dveche divaswapna, lack of physical activities and also the day sleep. And this particular combination that results in plethora of diseases that's referred as a santarpana nimittaja vikara. And this is one particular category. Next. Next slide, please. And what is going to happen in the body, where it is being said that the person who consumes a little bit excess, and that will cause excessive greasy body element in the rasa dhatu, that is referred as ama anna rasa. And this particular ama anna rasa that precipitates the overweight and obesity. And atisnahat meha medo janate. And what is that particular body element that is excessively formed in the body is medas, and that precipitates the overweight and obesity. This is one category of the etiopathogenesis. Yes, next slide. Next slide. And you have the three different terms used in three different chapters related to the same pathological phenomena. The one is amarasa, and that is considered as excessive or overweight and obesity. And this particular word is used in the context of the obesity in Sushruta Samhita. The second one is the Abadha Medas, that also refers to the same, and that's described in Charaka Samhita in the context of the Prameha. And the third one is the Shonita Abhishandana, that also refers to the same Amarasa and Abadha Medas, but it is described in the context of Srotopalepa. In other words, to say there is excessive kapha and medas in the body, and this particular excessive kapha and medas in the body in the rasa dhatu is referred as amarasa, Sushruta Samhita, and is referred as Abadha Medas in Charaka Samhita in the Prameha, and the same is referred as Shonita Abhishandana in the context of Srotopalepa, that's again in Charaka Samhita. But all these terms, they refer to the same etiopathogenesis. Yes, next. And it is being said that this particular etiological factor that causes excessive accumulation of the kapha and medas, the excessive fat which is present in the rasa dhatu, that does not form into the rakta dhatu, rather it forms into the medas in the body, and this particular medas, if it excessively accumulates in the back, buttocks, or it is in the abdomen, that is the front, and to make a balance from the front and also the back. Yes, next. And what is the clinical event? Meda sativa samrita sahasaiva analadaya. And it is not only the excessive fat in the rasa dhatu, it is not only the excessive fat that is deposited in different parts of the body, and more than that, it precipitates multiple diseases. And this particular multiple diseases, darunan vikaran darunan kritva. And these particular multiple diseases that are not the simple diseases, that rather it is mostly the fatal diseases that are caused by these events. Yes, next. Next one. And of course, this is the excessive consumption, and of course, it is the lack of physical activity. And this particular lack of physical activity that will precipitate the excessive accumulation of kapha and medas in the rasa dhatu, and in what way it is capable of causing fatal illness. The condition is considered to be avrta margatvat srotasam, and it is actually the margavarana that is the mediator, and the excessive consumption and lack of physical activity resulting in excessive kapha and medas in the body, mediated through the margavarana, it causes the fatal outcome, it causes the fatal diseases. That's about this particular pathology. Yes, next. And it is being said that the person who is overweight and obese likely to have excessive kapha and medas in the rasa dhatu. And is there any possibility that the person who is lean and thin may also have the similar illness, similar pathology? That's also possible. That means there is excessive in the showroom, that is obesity, but nothing in the godown, that is dyslipidemia, is there, not there. And the person who is lean and thin, nothing in the showroom, but excess in the godown, that is dyslipidemia, is present. This is another possibility, and this particular possibility is described with Namasyan Paisa Asa Abhyavare. And this is the concept of Viruddhahara, where it is being said that Shonita Pradushanaya, there is an abnormality that happens in the Rakta Dhatu. And in the Ayurvedic literature, Rasa and Rakta, these are considered to be the two body elements that circulates together in the body. And this is being specified in the Sushruta Samhita, therefore in the name of Amarasa, but the same Rakta Dhatu is circulating along with the Rasa Dhatu, and therefore the Charaka has described it as Shonita Pradushanaya Maha Abhishandat. And that causes the Shonita Abhishandana, and Shonita Abhishandana results in Margavarana or Margo Paropadava. So again, it is the same etiological phenomena. Yes, next. And how about the thin outside and fat inside, or it is a fat outside and thin inside? And that's about the, again it is the Margavarana, where it is being said that Shonita Abhishandana Damani Pratichaya. So the initial activity is a lack of physical activity and the excessive consumption. The result is the kapha and medas in the body, that's in the rasadhatu. And further what is going to happen, that's the abhishandana results in damani pratichaya, that is the next event. So the first event is, first activity is the nidana, and that's followed by the shonidabhishandana. Shonidabhishandana then results in damani pratichaya, this is the next event. Yes, next. And if all these informations taken from this Thaulya, taken from the Marga, taken from the context of Viruddhahara, if they are put together, and then Santarpada Nidana is the etiological factor, Kapha Medo Vriddhi is the event that is the result of that, and this particular Kapha Medo Vriddhi in the Rasa Dhatu is called as Amarasa, the same in the Rakta Dhatu is called as Shonita Bhishandana, and this particular Shonita Bhishandana results in Rakta Marga Upalepana, and that causes the Damani Pratichaya, and Damani Pratichaya eventually ends up with the Margavarana. This is the whole concept of this particular Santarpana Nidana, and the Santarpanotta Vikara is copied in the modern literature, is copied in the modern literature as sedentary lifestyle, metabolic syndrome, dyslipidemia, atherogenesis, atherosclerosis, and the thromboembolism. And this is the description of the same in the modern counterpart. Yes, next. And what about this particular Damani Pratichaya is a term. And this particular Damani Pratichaya is described as an illness. And illness in the sense, it's the illness considered as Kapaja Nanatmaja Vyadhi. And this particular Kamaja Nanatmaja Vyadhi is characterized by Damani Upalepa. That is the adhesion or the adherence of the kapha and medas into the vessel wall, that itself is considered Damani Upalepa, resulting in Damani Pratichaya. Yes, next. And this particular Damani Pratichaya considered to be the Raktaja Vikara so far as the Charaka is concerned, but Sushruta considered as Rasa Pradoshaja Vikara. And this particular difference of opinion for the simple reason that the circulation of the rasa and rakta that happens simultaneously in the body as accepted by Incharaka and also accepted in Sushruta. And therefore, there is a difference in the nomenclature of these two, but these two refers to the same condition. And Rasa Pradoshaja Margavarana is considered to be a Rasa Pradoshaja Vikara. For that reason, it is also referred as Damani Pratichaya. Yes, next. And what about this particular Upalepa? Upalepa simply refers to the Upalepa iva Upalepa, Tadatishayaha Pratichaya Atipuranam. The infiltration of the kapha and medas into the vessel wall, that is referred as Upalepa. And that itself is the phenomena of the atherosclerosis. Yes, next slide. And what happens this particular, when there is excessive accumulation of that and its adherence to the vessel wall, definitely there is a change in the vessel, and that is referred as the remodeling of the vessels, and that's actually referred as Damaninam Pustata. The size of the vessel, size of the vessel is also increased, and that's referred as Damaninam Pustata. This is also referred as the remodeling of the vessels. Yes, next. And when this particular, the kapha and medas gets accumulated on the vessel wall, and there is a change in the functioning of the vessel wall, that is referred as Damaninam Vistarabhavaha. And so far as the distensibility of the blood vessels is concerned, that depends upon the amount of blood which is present inside that, and it is the inherent ability of the blood vessel. When this particular distensibility of the blood vessel, when it is lost, the person is likely to suffer from the hypertension. But the literature specifies that whenever there is Damani Pratichaya, the size is increased, and at the same time, its ability to distend when the blood is present, that is also lost. So the elasticity of the blood vessels is said to be lost because of the Damani Pratichaya. Yes, next. And further, the final event is Damani Pratichaya Raja Granthi. When there is the narrowing happens, and narrowing will lead to a final event of formation of a thrombus, and this particular thrombus is referred as Siraja Granthi. Siraja Granthi is also considered to be a different disorder in the Sushruta method that refers to the venous hypertension or the separate disorders. But in the context of Dhamani Praticaya, where Siraja Granthi means there will be a formation of a Granthi within the vessel, that's referred as Siraja Granthi, and that itself is referred as a thromboembolism, and that particular formation of the thromboembolism results in Margavarana or the obliteration of the vessel. This is the final event. Yes, next. Or if all these informations are put together, then that is Viruddhahara or Santarpana Nidana. Either it is the Viruddhahara or it is the Nidana in the form of the Santarpana. Atisnehat Medo Janayati. Definitely there is excessive accumulation of Medas in the body. That causes Shonita Pradushana, and that the excessive accumulation of Medas happens in the blood itself. And the Shonita Pradushana in the sense in the form of Shonita Abhishandana or the dyslipidemia, and then it causes Damani Upalepa, Damanina Pustata, Vistara Bhava, Damani Pratya Siraja Granthi and Margavarana. So it is starting from that of the Viruddhahara and Santarpana Nidana. The final event is the Margavarana. This is how it is going to happen. Yes, next. And so far as this Margavarana is concerned, that refers to where the Marga refers to Rasarakta Marga. Marga doesn't mean any Marga which is present in the body, rather in the present context it refers to the Rasarakta Marga. And when this particular Margavarana is happening, where it can happen in any part of the body, because the Dhamani is present in the extremities where the Margavarana can happen. It's also present in the abdomen, there also it can happen, and it is present in the cirrus, and there also it happens. There also it can happen. And when this particular Margavarana happens in different parts of the body, the presentation is likely to be different. When the presentation is different, the disease is likely to be different. In the sense, if the Margavarana happens in the leg, then the symptoms are totally different, and depending upon the leading symptom, the disease is named. And so far as the Margavarana, when it involves the abdomen, where the symptom is totally different, and depending upon the leading symptom, the disease is named differently. And similarly, when the Margavarana, if it is happening in the head, and when it is happening in the head, the symptoms are likely to be different, and accordingly, according to the different the symptoms, the disease have to be named differently. That means Margavarana is a generalized illness. Depending upon the Margavarana that happens in a particular part of the body, the disease is accordingly named, or the Margavarana as a Nidanarthakara Vyadhi, and the events of the Margavarana as the Vyadhi itself or Vyadhi Sankara. And this is what is going to happen related to the Margavarana and the different multiple diseases. Yes, next. And why this particular, the Margavarana is called as Rasarakta Margavarana? Because the literature specifies that the liquid dhatu, that is Rasa and Rakta, that is simultaneously circulated in the body. In sense, for descriptive purposes, Rasa and Rakta is different, but for the practical purpose, so far as the circulation is concerned, that is simultaneous. And therefore, in Sushruta Samhita, that is referred as Amarasa, and it is called as Margavarana, and in Sushruta Charaka Samhita, it is considered as Dhamani Praticaya, and it is considered as Margavarana. Or else to say, the Margavarana refers to the Dhamani Praticaya resulting in obliteration, that is Margavarana. Yes, next. And when a person suffers from the Shonita when a person suffers from the Staulya, when a person suffers from the Dhamani Praticaya, and this particular Dhamani Praticaya can result in multiple diseases, and therefore the person who is having the event of a person is having the manifestation of a Dhamani Praticaya or the Shonita Abhishandana is likely to be chased by multiple diseases, and there is every risk of developing those diseases any moment in the body, and that is the situation. And therefore it is said that Vata Vikaranam Anyatanam Prapya Panchatvam Upayati. And how about these multiple diseases? These multiple diseases, some of them are likely to be fatal, and it may give an end to the life of an individual, and therefore that's considered to be very, very important, where there he says that Ataha Tasya Utpatti Hetum Pariharet. And if the person suffers from the Vata Vyadhi, that's very difficult to treat. But so far as the Shonita Abhishandana is concerned, it is treatable. Utpatti Hetu is Shonita Abhishandana, Utpatti Hetu is Amarasa, Utpatti Hetu is Abadha Medas, Utpatti Hetu is the kapha and medas in the rakta. And this is best treatable. And if this particular condition, Utpatti Hetu, is treated, definitely one can prevent the more serious Vata Vyadhi secondary to the Margavarna. And therefore it is being said that Utpatti Hetum Pariharet. Yes, next. And why this particular disease are considered to be different? The reason is, depending upon the location, the symptoms are different. And therefore the diseases are named differently. One such disorder is Vata Rakta. Vata Rakta is characterized by obliteration of the Rakta Vasrotas. And this particular obliteration of the Rakta Vasrotas results in the morbidity of Vata, and therefore it is called as Vata Rakta. And therefore Vata Rakta, that means the obliterate Margavarana is a phenomena, and if this particular phenomena, if it involves the leg, the diagnosis is Margavarana. And again that particular condition where the pathology is Margavarana. One thing one should remember, that there are different phenomena related to that of the Margavarana. One such a specific phenomena that is involved in the Vata Rakta is Kupite Marga Samrodhat Medasova Kapaseva. And here in this particular condition also, it is the kapha and medas that is the important important pathological phenomena. And therefore, when this particular medas and kapha is involved, the treatment for the Vata Rakta is also unique. Yes, next slide. And where it is said that the treatment should be aimed at the kapha and medas, and it is not aimed at the Vata, rather than it is aimed at the kapha and medas, because the patient is suffering from two diseases. One is the Nidanarthakara Roga, that is actually the Margavarana. The second one is Vyadhi, that is resultant of that is Vyadhi Sankara, that's actually the Vata Rakta. And therefore here it is Shilajita Prayogasya Gugguloho. Shilajita and Guggulu is considered to be with the best medicine for treating the kapha and medas anywhere in the body, including the Margavarana. And therefore, Margavarana, when it involves the leg, the diagnosis is Vata Rakta, the prescription remains the Shilajito and the Guggulu here. It is said that Purana Yavagoduma Sidu Arishta Surasabaihi, the same treatment that is adopted so far as this Taulya is concerned, same treatment that is adopted in the overweight and obesity, the same treatment has to be planned so far as the Vata Rakta is concerned, because the diagnosis is different, but the basic cause is the kapha and medas, and the treatment for that, the Shilajita and the Guggulu, that has to be prescribed in case of the Vata Rakta. Yes, next. And this particular Margavarana, when it involves the Shiras is considered to be such an important marma, where the different, the Indriya, including the control for the Jnanendra and Karmendra is present. When that particular marma is involved, the person is likely to suffer from multiple diseases referred as Vata Vyadhi. And here, Vate Vibadha Marge Meda Kapha Pitte, where he says that Pakshavada and such other diseases where that can happen due to the Margavarana. And when it is Margavarana is involved in the Pakshavadadishu, where he says that Kapha Pitta Raktena, and it is in the Rakta Dhatu, and it is the Kapha and Medas that is involved in this particular Pakshagata. And in patients suffering from the Margavaranaja Pakshagata, the Margavarana is specifically happening in the Shiras, and since the Margavarana is present, definitely the treatment for the Margavarana should be included. Not that the patient should not be treated for the Vata Vyadhi or Pakshagata should be treated. Along with that, the treatment of Margavarana, when it is added to that, the treatment is said to be complete. Otherwise, the desired response one cannot get, or the Margavarana can further continue to involve the different other parts of the body. And therefore, it is said that Vate Vibadha Marge Meda Kapha Pitta Raktena. Again in Vata Vyadhi, it is the same Kapha and Medas. Yes, next slide. And here, once again, in the case of the Vata Vyadhi, what should be the treatment? And the treatment should be for the kapha and medas also, where again it is said, Shailasya Jatanotirtam Payasa Guggulotava. And in case of the Vata Rakta, the Guggulu is being given along with the Triphala Kashaya. But when the patient is suffering from the Vata Vyadhi, the same Guggulu is prescribed, but it is given along with the milk. The reason is there is vitiation of the Vata also. And one has to consider the Margavarana, one has to consider the Vata. And therefore, a small modification in the treatment is made, but the treatment should be given both for the Vata Vyadhi and also for the Margavarana. And therefore, Shailasya Jatanotatyam Payasa Guggulotava Leham Bhargava Proktam Abhyase Kshirabhug Naraha, where it is being specified that Bhargava Prokta Rasayana or the Shilajita Rasayana or the Guggulu, this should be the treatment even in case of the Pakshagata, quite similar to the treatment of Vata Rakta. Yes, next slide. And in the context of Vata Vyadhi, further it is being said that if a patient who is suffering from the Margavarana illness, Vata Vyadhi, and if the treatment for Margavarana, if it is not done, if the treatment only for the Vata Vyadhi is given, in such occasions the patient will land up in the Vyadhi Sankara. The patient is likely to suffer from the Vyadhi Sankara, where it is, or else to say, if a patient who is suffering from the Pakshagata, if he is admitted to the hospital, if we take a history, the patient says the patient is already taking treatment for the heart. And why this particular multiple disease happen? So, a patient who is suffering from the ischemic limb disease, if you take the history, he is also having the history related to the disease related to the heart. Or a patient who is suffering from the stroke will have some of the manifestations related to the ischemic heart disease. And the reason is, in both the occasions, the pathology is same, the location is different. And if the patient is suffering from the Vata Vyadhi and it is the Margavarana involving the head, and if the patient is suffering from the Hridroga, probably the chest pain, where the Margavarana is involving the Hridaya, where it is being said that Hridrogo Vidradipleha Gulmo Atisara Evacha Bhavanti Upatravastesham Avartanam Upekshanat. So when in the context of Vata Vyadhi, it is being said that you are treating the Vata Vyadhi, and at the same time, if you ignore the Avarana in that particular occasion, the Avarana can result in multiple other diseases where the Gulma is also possible. And so far as this particular Gulma is concerned, that's related to it's not the Gulma of the Gulma chapter, rather it is the Gulma of the Avarana. That means it is the mesenteric ischemia. The patient who is having the Margavarana involving the other part of the body, where the ischemia, the infarction is the presentation. Similarly, this same phenomena can even involve the abdomen, then it is called as Gulma. The reason the patient presents with the severe abdominal pain. Severe abdominal pain is referred as Gulma in Charaka Samhita, and therefore the diagnosis remains the same. But here, the Margavarana is the major pathology that need to be concentrated. Yes, next. Margavarana can also cause the Unmada. The modern literature, if you see, it is being said that there is ischemia to the brain. That's related to the atherosclerosis. And this particular ischemia and infarction involving the brain, that will cause a phenomenon referred as vascular dementia. The condition is referred as vascular dementia, where the brain is damaged secondary to the vascular abnormality. And the Ayurvedic literature also says something about that. That's about the Unmada, where it is being said that Vataja Unmada is of two types. One, it is related to the caused by the etiological factor. The second one is that is caused by the Margavarana. And the one that is caused by the Margavarana is again, it is related to Savarnata Yoduktam Medaha Kafabhyam Anilo Aniruddhaha. And even in the context of Unmada, where it is being said that once again it is the Kapha and Medas is the culprit. And the Kapha and Medas, when it is the culprit that has caused the Margana resulted in the Unmada, definitely the treatment of Unmada has to be given. There is no second opinion regarding that. But at the same time, Unmada along with the Margavana, that should be the approach. And that particular treatment approach has to be considered in case of the Margavana Unmada. Yes, next. The patient who is suffering from the atherosclerosis may involve any other part of the body, including the kidneys. And if the patient is if the atherosclerosis involves the vessels that are related, or the arteries that are related to the blood circulation to the kidneys, definitely the patient will pass into a chronic kidney disease phase. And this is also described in the literature, where it is being said that Pittam Kapha Udvava Piva Bastau Sammaneteda Marutena Tada Mutram, the patient will suffer from the Mutra Ukasada. And what's about the Mutra? Tatra Vayuvaravana Krita Eva Kopa. And here in this particular Mutra Ukasada, again it is Margavarana Jakopa, and therefore it's not the treatment that is aimed at the Vata, rather the treatment should be aimed at the Kapha and Medas. That is the cause, or Kapha, Medas and the Pitta. That itself is the cause of the Margavarana. And again here it is the Margavarana and its treatment in patients suffering from the Mutragata. Yes, next. Ursula, it is well phenomena. And in patients suffering from the Ursula, Kapha Pitta Varuddastu Martha Kapha Rasamurchita, Rasa circulation is completely affected because the Kapha and Pitta is obstructing the Rasava Srotas. And again it is the Margavarana phenomena. And if the Rasa Martha Sambhava, that's Rasa and the Martha, these are the two phenomena that are involved in the pathogenesis of Hridroga and the Ursula, and the same has to be treated. And again, what should be the treatment here? Definitely the treatment for the Hridroga has to be done, but the treatment for the Margavarana should also be included. And here once again it is the same treatment. Tilah Vayamva Bishaka Pramatha Prayojet Kalpa Vidhanamashtam Prasham Tata Agastya Mathapilayam Rasayanam Brahma Mata Amalakya. And here the Prabhakara Bhatti, which is frequently prescribed in patients suffering from the Hridroga, again the treatment is the Shilajatu and the Loha Bhasma and the Makshika Bhasma. That itself is the content of the Prabhakara Bhatti. And here, when the Shilajatu is being given in such cases, it's you are treating the Hridaya. You are treating the Hridaya, the Margavarana Hridaya. And therefore, that itself is the approach. Yes, next. Or else to say, how about this particular Margavarana? Margavarana always presents with the sudden onset of the symptoms. The literature confirms that Avrto dosha lingani so animittam pradarshayet. Animittam in sense akasmat. The person who is absolutely normal in an office, working in an office and continuing some ledger work, the next moment immediately he is unable to use his hand. And you consider that the patient is suffering from this stroke. And this particular stroke is a manifestation of the Margavarana itself, because it is said in the literature that it is animittam akasmat. In the sense, spontaneous development of the symptomatology without any identifiable cause is the animitta, and that itself is the presentation of stroke. And so far as the manifestation of the chest pain is concerned, the angina is concerned, or the manifestation of the infection is concerned, heart attack is concerned, that's also the spontaneous. Or else to say, the spontaneous development of the symptoms with no any apparent cause is the very characteristic feature of the Margavarana. And therefore it is said that animittam akasmat, that's about the presentation here next. Another basic characteristic feature of this particular illness is the development of the symptoms at night hours. The Ayurvedic literature accepts that the person is active in the daytime and the person is less active in the night time. And the literature also accepts that the heart beats more during the daytime and the heart is slower at night time. And so far as the circulation is slower in the night time, the Margavarana can happen at night time. The literature also confirms the same. Vayoho nishayamayo visheshana kopat. And therefore, Margavarana events, stroke symptoms or strokes are usually, or most of the stroke happens during the night time. And so far as the cerebrovascular accident related to the infection is concerned, that is at the night time. And the cerebrovascular accident related to the hemorrhage is concerned, that probably happens in the daytime. And why it is night time, that's related to this particular, the slowed down circulation predisposing the thromboembolism that happens at night time. Similarly, the myocardial infarction is concerned. In most of the occasions, it happens at the night time. The reason is it's a slowed down circulation during this particular period. And the Ayurvedic literature also accepts that Margavarana mostly happens at night hours. And therefore, this is another characteristic feature related to the Margavarana. Yes, next. Next slide, if I. One should understand in this particular regard that Sarvadehika Samprapti and the Margavarana can involve the leg, Margavarana can involve the abdomen. When it is involving the leg, that is called as Vatarakta. Involving the abdomen, that is called as Gulma and Atisara. When it is involving the Hridaya, it is called as Urdroga. When it is involving the Chiras, it is considered as the Pakshagata, or it is considered as Unmada. In that particular, or when it is involving the Pastimarma, then it is called as Mutrauka Sada. And in that particular way, depending upon the location, the person is likely to suffer from the multiple disease. One thing is common, that's about the Vata Prakopa. And the second is Sthanika Dosha Drusti. And depending upon the location affected, there will be abnormality. And Rasadi Upachoshana, and then Animitta Pradarshana. More particularly, it is the Rasa and Rakta which is affected, and the spontaneous development of the symptom, that is Animitta Pradarshana. And Vishesha Ratra Kopa, most probably in most of the occasions, it happens at night time. And always it is the Balavanta Roga. The disease is considered to be more serious in terms of the pathogenesis, in terms of prognosis. Yes, next slide. And in all these conditions, the treatment of the individual disease have to be done. At the same time, Tilajito, Gugulu, Gomuta, Triphala, these are the treatments that are aimed at the Margavarana. That should be the additional treatment. And the combined treatment of the disease proper and the treatment of Nidanarthakara Roga, that is about the Margavarna, when these two are combined together, then the treatment is said to be complete, the response is likely to be better. Yes, next. Next slide. And if I see something about the dosha, Kapha Vriddhi is very evident, that Shonita, Bhishana, Staulya, these are all suggestive of Kapha. And Shudati Matram Vata Vyadi, this is considered to be the Pitta of the Vata dosha, and the Tikshna and Prameha Pitaka, if it happens associating these, this is suggestive of Pitta dosha involvement. And Shilajatu, Vidangadiloha, Prabhakaravati, Shiva Kutika, all these medications that are aimed at the Kapha and Medas, that should be added to the individual disease that the patient suffers from due to the Margavarana. Yes, next slide. Next slide. And further, Rasa, when it is involved, that we call it as Amarasa, Shilajatu should be prescribed. Rakta is involved definitely in case of the Vata Rakta, where the Guruji is being given. Mamsa, when it is involved, the patient will suffer from the Prameha Pidaka, then Varunadikana Kachaya should be given to the patient. Medas, when it is involved, then it is the Sveda, Daurgandhya or the Staulya, in that Kolakulata, the Udvartana and additional treatment. And Asti is involved, then the patient will suffer from Astishaya, where the Laksha should be prescribed. Asti Sausharya may be a manifestation, then the patient should be prescribed Mrgashranga. And Shukra, if it is present involved, that is Krishna Vivadi, is a manifestation of the Staulya or Margavana, when Musali has to be prescribed. Yes, next. And to conclude, etiology is one, the manifestation is the Margavarana. Margavarana is a Nidanarthakara Roga. In the sense, it can cause multiple diseases. And when it causes multiple diseases, the event or the consideration of the Vyadhi Sankara. And all the diseases that the patient is suffering from, that has to be treated at the same time. The root cause, the Margavarana, has to be treated. Therefore, this particular Nidanarthakara Roga status or the Vyadhi Sankara status is not considered as Ekarthakari, rather it is considered as Ubayarthakari. Margavarana will continue, or the Damani Pratyaya will continue, at the same time the resultant disease Vatarakta or Vata, that also continue, and therefore it is considered to be Ubayarthakari. And you have the concept of Swatantra and the Paratantra Vyadhi, and here the Margavarana is the Swatantra Vyadhi, and so far as the other diseases are considered to Paratantra Vyadhi, and Paratantra Vyadhi is also described as a Balavanta Roga, and when it is Balavanta Roga, and the treatment should be aimed at both the cause and the effect, and therefore Margavarana and the Margavaranotta Vyadhi both have to be treated. Yes, next slide. So, next slide. Yes, with these words I would like to step aside to say that when the patient is suffering from an illness, probably somebody has given this particular letter after my completion is running short of time. Okay, this is a late letter. So this particular concept is taken from the multiple chapters to consider that treatment should be aimed in that particular manner. The concept of Margavarana, the concept of the Nidanarthakara Roga, the concept of the Vyadhi Sankara, and the concept of Swatantra, Paratantra Vyadhi Chikitsa. This has to be adopted in Margavarana. So I should thank the organizers for giving me an opportunity, very particularly to Dr. Kishore Kumar for inviting me to this particular program to share the stage with Professor Prasanna Rao. Thank you.